Hey guys, this is Dr. Kyle with Columbia River Chiropractic, bringing you your next tip for Tuesday. You guys know I love to talk about foot issues because we see a lot of them in our clinic. Today in particular, we're going to talk about this joint and a diagnosis known as Hallux Rigidus. Now this is something that we see actually very regularly in our clinic, but it's usually accompanied with other issues as well, whether it be a bunion that usually occurs at this joint, things that are called Morton neuromas, metatarsalgia, lots of different foot things going on. This always tends to be a piece of that puzzle, and again is known as Hallux Rigidus. So basically what happens over the course of time is this joint gets stiff, maybe it becomes arthritic, and you tend to lose flexion of the toe in this motion. Now again, this is just one tiny joint in our foot, but it carries such a big significance as far as what our foot is able to do upwind into our ankle, and then even up into our knee, hip, and even our low back. Because, and I'll make a little quick demonstration here, in what's called the toe-off portion of our gait, so when we place our foot here, and then we get into this position where we are about to bring our toe off, we kind of push off with our toe. If that joint is so stiff that we're not able to fully get our foot into this direction, what will happen to compensate is we have to bend into our knee even more. We have to bend even more into our hip, and we lose the primary ability to recruit our glute max muscle, which, as many of you know, is a significant component of making sure we have a stable low back. So just by you not being able to get a full range of motion in your knee and your hip due to that stiffness in your big toe, this muscle will start to weaken and atrophy over time, and then you'll start to make all these sorts of compensation patterns that will build up as a direct result of you not being able to move this little tiny joint properly. Now the good news is, regardless of the stage of your Hallux Rigidus, for the most part, unless it's really severe, there's usually some progress to be made with just a lot of common adjustments that chiropractors will do, and chiropractors will focus on a lot of the soft tissue around the area as well. Overall, trying to focus on restoring normal function of your foot, which again will help with ankle, knee, hip, and low back function. So I can't state it enough. Don't overestimate this little guy, because it really plays into a lot of things that we see within our clinic. And I always encourage prevention. So if you can think of trying to keep this bad boy moving properly over the course of time, I guarantee it'll help kind of everything else that coincides with its function. So again, my name is Dr. Kyle with Columbia River Chiropractic. Thanks for watching.